Ever wondered why we have wisdom teeth? This enigmatic question has puzzled many for generations. To uncover the answer, we need to delve deep into our evolutionary past. Wisdom teeth, also known as third molars, are a vestigial remnant of our ancestors' dietary needs. Early humans had a diet that was drastically different from ours. They consumed a lot of rough, hard foods like roots, nuts, and raw meat, which required robust molar power to grind down. This is where wisdom teeth came into play. These additional molars were perfectly suited for the task, providing the necessary grinding power to break down tough plant tissues and raw meats. However, as our diets evolved and became softer and easier to chew, the need for these extra teeth diminished. Fast forward to the present day, and our jaws have adapted to our softer diets by becoming smaller, leaving little room for these vestigial molars. So, while our ancestors found them useful, for many of us today, wisdom teeth are nothing but trouble. Now that we know why we have wisdom teeth, let's delve into why and when they might need to be removed. One common reason for extraction is when the wisdom teeth, also known as third molars, are impacted. This means they have not fully emerged and are trapped in your jaw or under your gums. Impacted wisdom teeth can cause pain, swelling, and sometimes even infection. They may also push on other teeth, causing discomfort and potentially altering the natural alignment of your teeth. Overcrowding is another concern. Our mouths were designed to hold 28 teeth comfortably. But with the addition of up to 4 wisdom teeth, things can get a little cramped. This could lead to problems like misalignment or increased risk of gum disease due to difficulty in cleaning those hard-to-reach areas. Infection is also a potential issue. Partially erupted wisdom teeth can leave an opening in the gum where bacteria can enter, leading to infection, pain, swelling, and even systemic illness if left untreated. And let's not forget about cavities. Wisdom teeth, especially those that are impacted, can be hard to clean. This creates an ideal environment for cavities to form. If left unchecked, these cavities can lead to severe tooth decay and even the loss of neighboring teeth. Lastly, cysts or tumors can form around impacted wisdom teeth. While rare, these conditions can lead to serious complications, including bone destruction and jaw enlargement. In summary, wisdom teeth extraction is often a preventive measure. It's about avoiding potential problems down the line. It's not just about dealing with immediate pain or discomfort. It's about safeguarding your oral health for the long term. Of course, not everyone will need their wisdom teeth removed. Some people's wisdom teeth come in without causing any problems. Others may not have wisdom teeth at all, but if you do have them and they start causing issues, extraction might be the best course of action. So if your dentist recommends extraction, it's not without good reason. So you've decided to have your wisdom teeth extracted. What's next? Well, the journey to a wisdom tooth-free mouth begins with a few simple steps. The first stop is the initial consultation. Here your dentist will evaluate your oral health, discuss your options, and answer any questions you might have about the procedure. Next, you may undergo a series of X-rays. These X-rays are crucial, as they allow your dentist to see the exact position of your wisdom teeth and plan the extraction accordingly. They also reveal any potential complications that could arise during the procedure. The final and arguably most important step in preparing for your wisdom tooth extraction is disclosing your medical history and medications. This information is vital as it helps your dentist anticipate any potential risks and tailor the procedure to your specific needs. Remember, it's crucial to be open and honest with your dentist during this stage. After all, your safety and comfort are their primary concerns. Now, onto the main event, the extraction itself. The procedure begins when the dentist or oral surgeon administers a local anesthetic. This numbing agent is typically injected into the gum tissue surrounding your wisdom tooth. The goal is to ensure that you won't feel any discomfort during the extraction. Once the area is sufficiently numb, the practitioner will use a special tool to gently loosen the tooth. Sometimes this involves making a small incision in the gum to access the tooth more easily, especially if it's impacted or not fully emerged. This is all done with precision and care, so there's no need to fret. After the tooth is loosened, it's time for the actual extraction. Using forceps, the dentist or oral surgeon will grasp the tooth and carefully remove it from the socket. Some teeth come out in one piece, while others may need to be broken down and removed in sections. Again, this is a common practice and is done to ensure the most comfortable extraction possible. Once the tooth is out, immediate post-procedure care begins. The practitioner will clean the extraction site, removing any debris from the socket. They might place a gauze pad over the socket and ask you to bite down to help stop any bleeding. In some cases, a few dissolvable stitches might be used to close the gum edges over the extraction site. It's important to note that throughout the procedure, the dentist or oral surgeon is continuously monitoring you and the progress of the extraction. They will make sure you're comfortable and that everything is going as planned. They're skilled professionals who perform these procedures regularly, so you're in good hands. After the procedure, you'll be given specific instructions on how to take care of the extraction site at home. This might include advice on eating, drinking, and oral hygiene, as well as what to do if you experience any complications. While it may sound daunting, remember that extraction is a routine procedure performed by skilled professionals. So, as intimidating as it may seem, rest assured that you're in capable hands. You've made it through the extraction, but the care doesn't stop there. Paying heed to post-procedure care is just as crucial as the extraction itself. It's the backbone of your recovery process, and overlooking it may lead to unnecessary complications. It's like buying a beautiful new plant but neglecting to water it. Without proper care, it may wither and die. Let's talk about pain management first. It's completely normal to experience some discomfort after the procedure. Your dentist will likely prescribe you some painkillers. Stick to the prescribed dosage and schedule like a regimented soldier. Remember, these are not sweets to be taken at will. They're medications designed to help you heal. Swelling is another common post-extraction symptom. It might make you look like a chipmunk hoarding nuts for winter, but worry not. It's your body's natural response to healing. Cold compresses are your best friends here. Apply them to the affected area in 15-minute intervals. This will not only reduce the swelling, but also provide a soothing effect. Now onto your diet. For the first few days, you'll be on a culinary journey to the land of soft foods. Think mashed potatoes, yogurt, smoothies and the like. Avoid anything hard, crunchy or sticky that might disturb the extraction site. It's like walking on eggshells, but in this case you're eating around a healing wound. And finally, activities. You might feel like a superhero post-extraction, but it's best to avoid any strenuous activity for a while. No heavy lifting, no gym sessions, no wrestling matches with your siblings. It's time for some well-deserved rest and relaxation. Remember, every journey to recovery is unique. It's okay if yours doesn't follow the textbook timeline. Just keep your dentist in the loop and follow their advice to the letter. Proper care after the procedure can help ensure a swift and smooth recovery. After all, the goal isn't just to survive the extraction, but to thrive afterwards. Let's recap what we've learned today. We've journeyed through the curious world of wisdom teeth, those late bloomers in our oral landscape. We explored why humans have these third molars, which were once useful for our ancestors who needed to chomp down on hard foods, but are now often more trouble than they're worth. With modern diets, they've become rather redundant, and for some people they can cause discomfort, pain, or even serious health issues. We delved into understanding the wisdom tooth extraction procedure, a common dental surgery that removes these potentially problematic teeth. We learned that it's a fairly straightforward process, usually performed under local anesthesia, sedation, or in some cases, general anesthesia. The tooth is carefully removed, often in pieces, to minimize damage to surrounding tissues. We also highlighted the important steps to take before the extraction. Before the procedure, your dentist or oral surgeon will provide a detailed overview of what to expect. It's crucial to ask questions and express any concerns you might have. Make sure to arrange for someone to accompany you and drive you home after the procedure, especially if you're having sedation or general anesthesia. After the extraction, we discussed the importance of post-procedure care to ensure a smooth recovery. This includes resting, avoiding strenuous activity, and carefully following your dentist's instructions regarding diet and oral hygiene. It's normal to experience some discomfort, swelling, and bleeding in the days following the extraction, but these should gradually improve. Remember, if you're facing a wisdom tooth extraction, understanding the process can help alleviate any fears or anxieties you might have. Knowledge is power, and the more you know, the better prepared you'll be. And, as always, never hesitate to reach out to your dentist or oral surgeon with any questions or concerns. After all, your health is in your hands, and taking an active role in it is the best path towards a successful recovery.